PT-141, also known as bromelantide, is usually described as a libido peptide, but that description is too shallow. It is better understood as a desire circuit peptide because sexual function isn't just one system. It's not just hormones. It's not just blood flow. It's not just confidence. It's not just relationship dynamics. It's the nervous system, endocrine system, vascular system, emotional state, medication history, stress physiology, and lived experience all converging at once. That is what makes PT-141 so interesting. Unlike drugs that primarily focus on blood flow, PT-141 works through melanocortin signaling in the central nervous system. That means this peptide points us toward the brain's role in desire, not just the mechanics of performance, the biology of wanting. And that distinction matters because low desire is not always a testosterone problem. It's not always an estrogen problem. It's not always a blood flow problem. Sometimes the desire circuit is quiet because the patient is exhausted, inflamed, sleep deprived, overstressed, depressed, anxious, disconnected, over-medicated, under-recovered, or stuck in chronic threat physiology. So, PT-141 is not just simply asking, can we increase libido? It's asking a better question. Can the brain and the body still generate the desired signal? That is the clinical lesson here. Desire isn't just a hormone level. It's a neurological state. It requires safety, energy, blood flow, hormonal context, emotional availability, autonomic flexibility, and a nervous system that is not locked in survival mode. That is why PT-141 can attract attention, but it also requires real clinical thinking. It is FDA approved as bromelantide for acquired generalized hypoactive sexual active disorder in premenopausal women, but it's not approved as a general performance enhancer. It is also not appropriate in patients who have uncontrolled hypertension or known cardiovascular disease. So the clinical decision isn't who wants more libido. The better clinical decision is this truly a desire circuit problem, or is low libido a visible symptom of something else? Is it medication related, hormonal, stress related, sleep related, pain related, relationship related, trauma related, mood related, cardiometabolic, or vascular related? Because if the driver is not understood, the peptide can become another variable in a noisy system. That is the Praxis approach to peptide medicine. Don't reduce PT-141 to a sex peptide. Understand the circuit, understand the patient, then decide whether the mechanism belongs in the conversation.